Good morning. Welcome to Beside You, the live on Friday morning. I do need to make a little confession before I start. This isn't live. I have pre-recorded this video because I'm working from home at the moment and my smallest child is 3 and would take great delight in jumping around in front of me and trying to shout out over me while I'm talking. So I decided to pre-record the video to save you all from that. If you have any questions though, I am going to be able to reply to your questions in the comments, so please throw me any questions that you want to ask and I will try my best to answer them. If I can't answer them straight away, then we will revisit them over the next couple of days and see if there's any more questions to be answered. So even though it's not live, hopefully you will still get any of your questions answered. So my name's Tamsin. I am a midwife. I work at Medway Hospital on the postnatal ward. I've also almost completed a breastfeeding specialist course and I'm part of the infant feeding team known as Team Romina. Our team is led by Hayley Clinton, the infant feeding lead. You might have seen her name with this link as well, and she'll also be there to answer any questions in the comments. And we're called Team Romina. Romina was the Roman goddess of mothers and breastfeeding, so that's how we got our name. I work on the postnatal ward mostly, but at the moment I am working from home doing video support calls and things like this, obviously. So I've been asked today to talk about the kind of emotional challenges of pregnancy and the physical changes going on in your body to prepare to feed your new baby. So if you're watching this while you're pregnant, hopefully you're going to pick up on some things that I say. Perhaps they'll reassure you that your body does know what it's doing. But if you've already had your baby, there might be some things that you might pick up from this video as well, so it's still worth watching. There is quite a lot of the kind of science stuff, but I'm going to try and make it as manageable as possible. I'm going to talk also a little bit about colostrum, that first milk that you make, and colostrum harvesting, so that is expressing that milk during pregnancy in preparation for when your baby is born. So if we start with that emotional side of things, so at the moment things are really tough for lots of people. Lockdown has been not quite, I'm sure, what you were expecting your pregnancy to be. Perhaps you were going to have a baby shower that now can't happen in the way that you thought it would, or those face-to-face midwife appointments, and now you're having a phone call maybe or a video call, and that can be really, really challenging. I think the first thing to say there is it's okay to feel like those things are challenging right now. Your feelings are completely valid, but also it's really important to talk about those feelings. There is a lot going on in your body at the moment. You're growing a new life. That takes a lot of physical changes, hormonal changes, lots going on. It's tiring at times. Some women get that bloom and they seem to just thrive and do amazingly in pregnancy, and other women find it really tough. So I think it's important that you get support and you talk about your feelings and what's going on for you, what your reality is at the moment. So there are a few things you can do to try and help at this point. Trying to eat well, trying to sleep well, those are of course important, but sometimes really hard to do. If you find that you're not really putting the focus on yourself right now, perhaps it's time to take stock and put that focus back on you. You are allowed to put yourself first, to make sure that you get the things that you need to feel good. Please make sure that you do have your contact with your midwife, whether that's a phone call or a video call or a face-to-face appointment. It's still just as important that you have that contact. And you can talk to your midwife about how you're feeling, how you're coping with things. Try to get out of the house, maybe once a day if you can. It's so easy in lockdown to just roll out of bed, roll onto the sofa, watch a box set, eat all the food, go back to bed. But then you end up not feeling so good. So it can be so hard to do, but once you've done it, you feel so much better. So just getting out of the house and moving your body can do wonders. We do have a team of mental health midwives who specialise in supporting women who are struggling, and they are amazing at what they do. There's going to be a link if you need to contact them for support. We're going to put a link on for that. But sometimes just being able to relax can really help you. And I thought it might be nice this morning if we could just have a bit of time of relaxation. Not very long, don't you worry. Just a short moment to relax, to stop, to try to ignore all the chaos around you and just be focused inwards. Focusing on you and your baby. If you're pregnant, connecting with your baby can be a really powerful way to come back into the moment, to stop that worrying about the future, the past. You're just in the moment and connecting with your baby. Holding your bump, talking to your baby, all those things can really help you, but also your baby. You're helping to grow your baby's brain every time you make that connection with your baby. So it's a great thing to do. But for you to relax, something really simple and really powerful that you can do is just to focus on your breath. I'm not here to teach you how to breathe. I am pretty sure you've all got that sorted. What I'm going to do is just talk you through a really simple relaxation that you can do anywhere and for however long feels right to you, whether it's a minute or 10 minutes, it doesn't matter. So if you're able right now to just get comfy, close your eyes and breathe. Slow, steady breath. In and out. As you breathe in, notice how that breath feels. How it feels as it goes into your nose, down into your lungs. As you breathe out, notice how that breath feels leaving your body and taking all of your tension with it. If you're wearing your shoulders as earrings, try to lower them down. Feel the stress and tension leaving your body as you just breathe in and out. And slowly open your eyes when you're ready. That's it. That's all you need to do. Just slow, steady breath that you focus on, that you notice that breath and you stop. And it can really help. One of the reasons that you're feeling the way that you are is because there's so much going on in your body right now. Your body is growing your baby without you having to tell it what to do. You don't have to think, oh, I'm going to grow fingernails today. Your body just does it, which is amazing. And in the same way, your body is automatically getting ready to make milk for your baby once it's born. You're a mammal, the same as all other mammals that you can think of. Help me out here, brain. Think of some mammals. Camel, zebra, cat, any mammal that you can think of that feeds milk to their babies. Fundamentally, you're the same. Your body is designed to make milk for your baby, and it's designed to make the milk that's going to be tailor-made and perfect for your human baby. So while you're pregnant, lots of changes are going to happen in your body to your breasts to prepare them to make that milk. We call it lactogenesis, and specifically the part in pregnancy is lactogenesis 1. There are 3 stages. There are lots and lots of big words involved with lactogenesis, and I'm going to try and break it down for you because I've been asked to talk about the science bit. So bear with me and we'll walk through this together, and hopefully by the time we get to the end you'll have a bit of a better understanding about what's actually happening in your body and why these weird changes are happening, and how that's going to help prepare the way to feed your baby. So first of all, lactogenesis, that starting to make milk, happens from about 16 weeks of pregnancy, which is really early on, and that comes as a surprise to lots of people. But actually think about that early pregnancy. Did you find that you had to walk around with your arms up here because your breasts were really tender, all tender under maybe in your armpits, lots of things going on, and your breast suddenly grew? Those are changes happening in your body to start to make that milk. So from about 16 weeks, you're going to get hormones working to get that milk production underway. So we call that the endocrine control system. You don't have to call it that. It's just your body getting ready to make that milk. So the first hormone that you've got going on, that's the hormone that makes milk, is called prolactin. That's the hormone that during pregnancy is going to wake up all the cells in your breast, the ones that make the milk. It's going to wake them up and say, hey, we need you to do your job now. We need you to start thinking about making that milk for us. And the milk that it makes at this point is called colostrum. Colostrum is a really, really rich, concentrated milk that has everything your baby needs in tiny, tiny quantities. Your body knows that your baby is going to be born with much too much fluid on board that it needs to get rid of once it's born. So your milk is tiny quantities so that we're not putting more extra fluid into your baby. And your body knows that, so it's going to pack into this colostrum lots of energy, fats, proteins, immune factors, all sorts of wonderful ingredients to make sure that your baby gets what they need when they're born. You're making this milk in tiny amounts because of a hormone called progesterone. Progesterone is a hormone that your placenta, that bit that's giving your baby everything that it needs and taking away all the waste, your placenta is making progesterone, which keeps the level of milk quite low. And that's a really handy thing to do during pregnancy. You don't want to be making loads and loads and loads of milk during pregnancy or in those first couple of days. Once you have your baby and the placenta has gone from your body, then your progesterone levels, that hormone that's stopping and slowing down the milk production, those levels go down dramatically, and that allows the prolactin, the hormone that makes the milk, to suddenly go shooting up. So over the next couple of days, so by about day 2 to day 3, you make milk in a much bigger quantity. The ingredients stay quite similar, but the water content is much higher once your milk comes in. So these changes that are going on in your body caused by the hormones, you can see those changes on the outside. And you might think that the changes happening to your breasts just seem really quite bizarre. So you've got suddenly veins all over your breast that you can see like a tube map. There's suddenly, you can really see them. You need a really rich blood supply to make all that milk. It's important that that happens. You'll also notice that your nipple and your areola, that's the darker bit around your nipple, get darker and your nipple gets bigger. Again, this is caused by those hormones that are working in your body to make changes. The reason for that one is because your baby can't tell the difference between colours that are really similar. So before pregnancy, you might have found that your nipple and areola were almost the same colour as the rest of your breast. By making them darker, your baby can see that difference and can use it as a little target and go, oh yes, I see it. You're also going to notice some bumpy bits all around your areola. Those are called Montgomery's tubercles. Awesome name. And those have a really important job to do. They secrete a fluid that smells a lot like amniotic fluid, so the fluid that's surrounding your baby during pregnancy, and it smells the same. You can't smell it or see it, don't worry, but your baby can. They have a really, really strong sense of smell, and they can smell that fluid. So we can see from that knowledge that your body is going to start making milk from about 16 weeks. We can see that if you have your baby prematurely, so if you have your baby early, your body can make milk. It's already doing that work to make milk. So we will encourage you to express your milk as soon as your baby is born, if they're born prematurely. Up until about 36 weeks of pregnancy, a baby can't coordinate their sucking and their swallowing and their breathing very well. It's a complicated thing to do. So they might have trouble actually feeding from the breast. But that doesn't mean that they can't have breast milk. You can express that colostrum for them. And in fact, for your premature baby, your body will make sure that your colostrum has even higher concentrations of the immune factors, that it has higher energy, higher fats, just tailor-made for your premature baby, which is pretty amazing. Your midwife will help you to express your milk for your baby, hopefully within the first hour or so after baby being born. Sometimes that's not possible, and that's okay, but that's our sort of ideal window. If it's later than that, it's okay. So why do we go on about colostrum being this amazing thing? Well, it's got some pretty incredible properties. The first one of those has a really long name called secretory immunoglobulin A. Basically, what it does is it coats the lining of your baby's gut so that it stops any bad bacteria from being able to get through that barrier, so protecting your baby. And it also has a really perfect acid level so that it encourages good bacteria growth and not the bad bacteria, so that your baby can start their immune system. That all kind of starts in the gut, so it can help to do that. Basically, it acts a bit like a paint or a sealant on their gut wall to make sure that they stay as well as possible. It's also really concentrated high levels of energy, proteins, fats, all those kind of things to give your baby what it needs without giving them lots and lots of volume that they just can't cope with when they're so little. It's also a laxative, so it makes your baby poo out all of that black sticky poo. We call it meconium, you might call it tar. It is sticky, black, gets everywhere, and if you've had your baby, you will know how difficult it is to clean up. Marvellous. But what your colostrum is doing is making sure that all of that is going through their system and out, because they don't want to keep that build-up of meconium that they've built up over time whilst they've been growing inside you. They need to get rid of all of that. So we recommend that from about 36 weeks of pregnancy that any mum who is high risk, so perhaps you have diabetes, perhaps you're having a planned cesarean, we would recommend that you hand express small amounts of that colostrum just in case. You might not need it, but if you do, it's really reassuring to have that on hand. Now, I'm going to talk you through a technique of how to hand express, but as with many things breastfeeding related, there is not a one-size-fits-all rule. You're going to find what works for you. So treat everything that I'm saying here as a buffet. You're going to take what you like the look of, and you might try it and you might think, oh, actually, no, I don't like that, I'm going to leave that. Or you might pick up something and go, oh, yeah, that sounds like that might work for me. Oh, yeah, I do like that. That's pretty good. And some of it you're just going to leave and think, no, that's not for me. I'm not going to try that. That's okay. Do what works for you. So we call it colostrum harvesting, and you can ask your midwife for a colostrum harvesting kit. In that kit, you're going to find some little tiny 1 ml syringes and some slightly bigger but still tiny 5 ml syringes. Those are the kind of quantities we're talking about. If you can express maybe 1/2 ml, that's amazing. That's loads. So anything that you can express is fabulous. And once you've got your kit, you can express as much as you really want to, what you're comfortable with. And the technique I'm going to talk you through is quite a basic technique. You can Google it and find some more complicated ways of doing things, and that's okay, but I'm just going to go through the basics. So you're going to start with clean hands, and those syringes that we give you in the kit, they're kind of all sealed, so they're sterile when you open them up. So just be careful when you're handling them. Don't let the dog lick them and stuff. Although breast milk has got lots of antibacterial properties, but we'd rather keep things as kind of clean as possible. So you're going to have clean hands, and your aim here is to kind of wake up the breast, tell them that you want to get access to that milk that they're amazingly making inside, to release that milk, to move it down those milk ducts, which are sort of a little bit like little branches of a tree that kind of come down really from quite high up on your shoulder into your armpit, all the way up around here. They cover quite a lot of area. It's not just this bit of the breast that's involved in feeding. So you want to wake up your breast, let it know that you want that milk. You want to get those hormones working with you. So the hormone that makes milk that I talked about earlier, the prolactin, that is stimulated by touch. So it's really important that you have that touch before you start expressing. Massage, really important. You're also trying to get a hormone called oxytocin. You might have heard of that one. That's a feel-good hormone, the hormone of love, and that hormone is going to help to push the milk out of your body. So first of all, you're going to massage, and really any technique that works for you is going to be the one for you to use. It needs to be firm but not uncomfortable, so it needs to feel good. If it doesn't feel good, then it's not going to do very much good to get the milk out. So whatever feels good to you. Moving the breast around can really help some women. Leaning forwards can really help. Really anything that you can do to wake up your breast, to massage your breast, to get things working is going to help. And also pulling or rolling your nipple can help. You know your nipple is much more sensitive than the rest of your breast. Now you might feel really uncomfortable with the thought of basically playing with your breasts, but this is about milk production. It's not a sexual thing, and a lot of us find it quite difficult to separate those two things, and that's okay to find that difficult. But also I think it's important you get used to touching your breasts, getting used to what feels nice for you, what your breasts feel like, learn techniques that work for you, and try to kind of work through that maybe slight embarrassment that you feel when you start doing this. This is part of your body, and your body is amazing. It's doing amazing things. We sadly live in a culture where we have been programmed from a really young age to think that our bodies are somehow wrong. They don't look right. They don't smell right. There's just something not quite right about your body. But you know what? Your body is amazing. And right now, if you're pregnant, it's growing your baby. That is an amazing thing that your body is doing, and it's doing it really well. So trust your body. Trust that it's going to do what it's supposed to do. There isn't a reason that it's not going to do that. there's a tiny, tiny number of women who might have some issues, but that's going to be really specific to you. For most of the population, your body is going to do the things that the textbooks say that it will do. It's going to release those hormones. It's going to start making that milk. So trusting your body is something that can be very difficult in our culture, but really powerful once you get to that point. So back to the hand expressing. So you've massaged, you've woken your breast up, you've told it that you want the milk. Next thing you're going to do, you're going to make a C shape with your thumb and your forefinger. You're going to feel back from the nipple, probably to about the edge of the areola. And you're feeling for kind of bumpy bits under the surface. Sometimes they feel a little bit like broccoli. Sometimes you can't feel them at all, and that's okay. As a general rule, they sit just on the edge of your areola, but we are all a little bit different. So move around a bit. If you're trying here and you're not really getting anything, then try a slightly different position. A technique that works well for lots of women is to push the breast back towards your chest, squeeze firmly, and then release. What I expect to see at that point is absolutely nothing. What you've done there is you've just moved the milk a little bit from here to here, and it's going to continue to move down the more that you do that. So you're going to again push back, squeeze, and release. You might need to do that again. Push back, squeeze, and release. And you might see at that point a tiny, tiny drop of milk on the end of your nipple. And sometimes this is a two-person job where your glamorous assistant will come and use a syringe to get that tiny bit of milk. Once you get the hang of things, you'll find it much easier to do that just yourself. But at the start, you might find you need a bit of help. And you're just going to continue to do that. And do that kind of pushing back, squeezing and releasing motion until there's no more drops of milk. And then what you're going to do is you're just simply going to move your hands around to a different position on your breast. You've got 360 degrees of milk ducts, and you need to make sure that you're getting to every single one. So you're going to just work your way around your breast until you aren't getting any more milk. Try not to rub on the surface of the skin too much as you're expressing, or kind of pulling forward doesn't tend to work very well and can be really uncomfortable. You can make yourself really sore by doing this kind of rubbing technique and pulling. Try and not really move your fingers around on the surface of the skin too much. It's just that pushing back, the squeezing and the releasing. Like I said, there's lots of different techniques out there, and you're going to find the one that works for you, but that's a good basic starting point. Storing your breast milk, you can keep it at room temperature for 6 hours, in the fridge for 6 days, and in the freezer for 6 weeks. Don't keep it in the door of the fridge because the temperature goes up and down as you're opening the door. Make sure it's actually in the main part of the fridge. And if you've got just an ice compartment in a fridge, storage times are slightly different. But off the top of my head, I can't remember exactly what they are. One of my very helpful colleagues, I'm sure, will put that in the comments for you. And it's important as well to label that milk that you express. Label it with your name, the date that you've expressed it. You can put the time on there as well, but that's not so important. And we'll try to use it in the same order that you've expressed it. And that's it. We're going to be doing the next couple of sessions as well. In our next session, we're going to talk about that first 24 hours. What do you do with this brand new baby that you now have? Common struggles that people have going through things like position and attachment. How do you actually do it? And hopefully answer some more questions about that first day. The next session will be looking further ahead after that first 24 hours, those changes, what's going to be different then, and we'll kind of go on from there. So I hope that's been helpful for you this morning. Like I said, if you've got any questions that you want to ask, you can pop them in the comments and we'll try our best to answer all of them as quickly as we can. And we will see you again next week.